We always tell women that they must palpate their own breasts. It's very, very important for females and males, Don't forget 1% of cancer can occur because males have a breast too. For some reason, people never realize that males have a breast. They do. It's just a smaller one. It's just got lesser glands in it. It's got lesser fat in it, and therefore you don't see it. It's next to the chest wall. But the best way is to yourself palpate your breasts, which means feel your breasts, particularly either in the bed, in the privacy of your bedroom, or when you're taking a bath. But it's important to take it at the same time. Do this examination, self-examination in all its quarters. Use the finger, the pulp of the fingers to press down the breast on the chest wall and feel for discrete lumps, not large type granularity. Discrete, which means isolated, hard and painless lumps. These are the ones which are sinister. These are the ones that should raise an alarm or bell somewhere. But self-breast examination either before the periods or after the periods, because if you do it during the periods, the breasts are enlarged anytime and they're engorged because of the hormonal surge, they get enlarged like the inner lining of the uterus. That's what produces the menstruation, doesn't it? So it's endocrinological activity, normal. Breasts swell up. If you palpate on that point of time, you're going to get misled. So it has to be when the glands are hormonally relatively inactive. So either before the periods or after the periods, but more or less the same time every month. It's only then, the first few times when you do it, it takes a bit of time knowing the real feel of one's breasts. How do they feel in this area? But if you notice something new coming up, then you're the best person to notice it. And usually you could notice, even palpate something as small as a pea, even lesser than a pea if you're sensitive, But so the self-breast examination is a good way. The other way of detecting it is to do either a soft tissue X-ray that is called as a mammogram, because most 90% of cancers are visible on a mammogram. Some young breasts below the age of 35 or 30 are so glandular that they don't look good and clear on a mammogram. And these glandular enlargement obfuscates and hides all gland detail of the breast which you want to look out for in case of a small cancer. So in those breasts, it's always good to get an ultrasound done, not a mammogram. So younger, dense, radio-dense breasts require an ultrasound. And then of course, if you notice something funny, the best thing to do is to go to your doctor, who will do what is called as a clinical breast examination, which means breast examination by a trained physician or a surgeon who it requires a bit of training to examine the breast. And when you do that, and even the armpit, the entire breast in all its 4 quadrants and in the center, in the nipple areola, needs to be examined along with the axilla on that side for any lymph node enlargements. This is called a clinical breast examination. And when in doubt, please don't wait to ask, or you yourself stick a very fine, thin 26 gauge needle, aspirate some cells in a syringe and put it on a slide and send it to your cytologist. Your cytopathologist, all reasonable departments have cytopathologists for them, and they do what is called, immediately do an FNAC, a fine needle aspiration cytology. So, to answer your question, a clinical examination of the breast, an ultrasound, and a mammogram. This is called as a triple test. A triple test is the best way to basically detect a cancer, unless things are so small that you're not able to feel them. Then the most sensitive investigation is an MRI, a contrast MRI of the breast. In fact, the MRI is an overkill. It sometimes brings out things which are routine and unnecessarily raises flags for cancer. It is oversensitive. It's an investigation. It is so lucid and clear that you could go wrong and hedge on the other side, overdiagnose things and send people on wild goose chases. So you've got to keep that in mind. And of course, now, earlier on, we used to get an ultrasound. You need to check the distant sites. I told you about the liver, the lungs, the bones. So a scan for each of these, an ultrasound for the liver, or a chest, good digital X-ray chest for the lungs, and for the bones, a bone scan, an MDP bone scan. But now, if you want to get really, really slick, then you just do a CT PET scan today. After you've proven that you're dealing with a breast cancer, you now need to stage that cancer, because the treatment will be dependent on the stage, and so will be the outlook of that person. So therefore, nowadays you do a CT PET scan, a combination of a PET scan with a CT scan that gives you the best results. One shot tells you everything that you need to know about that breast cancer in that particular lady. That is what should ideally happen, because you need to monitor these investigations. They work cut both ways. They don't come free. They don't come easy. They develop. They sort of gulp huge financial resources and mental agony into their process, and of course valuable time. Who's got the time today? So it's best that they are regulated, so that only those people get these sophisticated investigations, those who understand the cost-benefit ratio of that investigation. That is what should happen if one wants to do things the right way.